Good evening, everyone. Thank you for joining us for our Men's Health webinar. I'm Jamie Callie with RWJBarnabas Health Medical Group. Tonight, I'm joined by Dr. Kim, our family medicine and sports medicine, Dr. Altmann, cardiology, and Dr. Patel, urology. We're going to discuss some common health concerns and preventative care for men tonight. Welcome. Thank you so much for joining us, doctors. How is everyone this evening?
Doing well.
Very well.
Good, good. So let's jump into it. Hopefully, nice, easy first question, but what are just some good, basic, healthy habits that all men can create and support to have overall health, from adolescence all the way through to older age?
Yeah, I can start this one. I think very commonly we as men, we try to push through things and only go see the doctor when we're sick and absolutely can't do it anymore. But my shameless plug here would be to go see your friendly neighborhood PCP, go get your annual physical, before the problems start. And the way I liken it is, on the airplanes, they always give you that safety message and demonstration. You got to put the mask on yourself before you take care of others. So that's my message to all men out there. You gotta take care of yourself if you want to take care of your families and others. So go see your PCP, get your annual checkup and physical for sure.
So I can go second. I completely agree with what Dr. Kim just said. You should visit your family doctor regularly, and I'm sure he'll give you great advice. As a cardiologist, I see a lot. Obviously, I see a lot of heart disease. It's the leading cause of death for American men. And to a large extent, it's preventable. And I think Dr. Kim will agree with me. Most people know what they should be doing, which is don't smoke, maintain a healthy weight, eat a healthy diet, stay away from the foods Americans love, like fast foods and fried foods and meat. And eat a diet high in fruits and vegetables and stay away from saturated fats and high in complex carbs. Exercise. I understand Dr. Kim's also a sports medicine expert, so he can tell you that Americans don't get enough exercise. We go from the bed to the car to the office desk and then reverse everything with a few hours of television or computer time in between. But those are some of the basic things that we all should pay attention to as we get older.
And this also translates, to not to just cardiac health and things like that. And, we always think about, maintaining a good, healthy diet and exercise to prevent death and heart disease, but even, some early signs especially for men's health. Simple little things as controlling your diet, controlling your weight can also make a big difference in the bed. So in terms of testosterone levels, erectile dysfunction, all of those are downstream effects of having a poor healthy diet or being overweight. I can personally attest, actually, myself, I was overweight like 2, 3 years ago. And then during COVID, I found some extra time and actually started exercising with simple exercise, even like just lifting some simple weights twice a week. I was actually able to raise my testosterone levels almost 80 points. So I can tell you, from a living a good, healthy diet, like even simple exercise, controlling the sugars, you'll have a much higher level of testosterone and it will translate into the bedroom in terms of erectile function. So it does matter significantly.
So diet and exercise are really where it's at.
Yeah, and you don't have to be a bodybuilder. Even like just simple walking will make a big difference.
Excellent. And you had mentioned a few conditions already, but what are some common conditions that men are more at risk to develop?
Well, men tend to develop heart disease and blockages about 10 years earlier than women. And men have a shorter life expectancy, and that is part of the reason. But unfortunately, most men end up with heart disease, even if it's not obvious, but the process tends to start relatively young in age. But high blood pressure, high cholesterol, blockages of the arteries, risk for stroke and heart attack and heart failure and kidney damage are things I think a lot about. And unfortunately, they affect far too many American men.
That's great. And that sort of like rolls into my next question, which is, heart health, I feel like is a really big topic, just across the spectrum. But you had mentioned that men especially have a higher risk for certain things. So when is a good time to start talking about heart health with your doctor?
Very young. I mean, this process really starts at a young age. Um, and seeing somebody like Dr. Kim and getting an annual checkup is something we really should start very early in life. Most people should get their cholesterol checked certainly by the age of 20 for the first time. But unfortunately, we have some data from autopsy studies and young men who died in battle, and a significant portion of them already had hardening of the arteries, even in their teens and early 20s. So this is a process that should start really young. I mean, if you look at what young Americans eat, major sources of calories are pizza, soda, candy, and when I say candy and desserts, I include a typical American breakfast because it often includes, a waffle with syrup or a very high sugar cereal, but and then things like fast foods and hot dogs. So at a very young age, we develop habits that really could be a lot better.
And Dr. Altmann and Dr. Kim, you're welcome to also answer this question, but and I'm sure, like as you mentioned, diet and exercise go into some of this, but what are some heart healthy habits men or young men can develop to sort of get out of that eating pattern?
Well, I always try to tell my patients, the recommendation is you're getting 150 minutes of moderate intensity exercise per week. Now, that sounds kind of daunting, but if you split it up amongst the 7 days of the week, it's certainly manageable. And by moderate intensity, it means that something that's going to get your heart rate up and going, will make you sweat a little bit. Everybody's got to start somewhere, though. I know some people aren't used to that. They've never done that, and maybe they're not ready to do that. But you got to start somewhere. So even if you're just starting to walk and lightly start going, get your heart rate up, do that a few times a week, and slowly build your way up until you can get to that threshold. It goes a long way in terms of protecting your heart, and I'm sure Dr. Altman can agree with that.
Absolutely.
And is there anything that could be added to your diet? I know red meat for a while was something that we were told, stay away. But instead of subtracting, is there some type of food or something we could be adding to our diets? More of a type of fruit or vegetable or vitamin?
Yeah, I always refer to like the My Plate. That should be the kind of standard for what your plate should look like when you sit down for your meals. It gives you a good balance in terms of the carbohydrates, the proteins that you're supposed to have, and the fruits and vegetables and stuff like that. I think I think too much in especially here in the States, we're focusing on the carbs and getting a lot of the white rice, white pastas instead of the more kind of heart healthy brown whole wheat options, whole grain options. And nowadays, if you go to any supermarket, you'll find a lot. There's which is a good thing, I think, is more of a focus on the health foods. So instead of white rice, you can try things like quinoa or oats, grains, things like that. Cauliflower rice is another popular substitution. So there's a lot of certainly options available to you. You just kind of have to look for it. But yeah, I would always refer to the, if you just look up on Google My Plate, it'll kind of give you a diagram and show you what the proper portion sizes should be.
And just to follow, I mean, everything Dr. Kim said is exactly right. In terms of supplements, there are very few supplements that have been shown to be of benefit. If you eat the kind of well-balanced diet that Dr. Kim described, you really shouldn't need to take anything out of a bottle unless there's something unusual about your history.
So unless like you were to have blood work or something and you were like lacking a specific mineral or vitamin.
Right.
Okay, so
that
makes things easy.
And as you mentioned, like, we always tell people like, don't eat this, don't eat that. But the one thing that, we do often undersell and that patients should be having more of, and we sometimes forget to mention it, is water. We
Yes.
always kind of reach for coffee, and unfortunately, we see it in our practice a lot, where patients come in with kidney stones. If patients just drank enough water, as opposed to always reaching for like a bottle of like soda or coffee or iced tea, with your meals, you really should be drinking water. Have your cup of coffee in the morning. Everyone needs that. Even listen, I get nasty without a little bit of coffee. But with your meals, don't always reach for a can of soda or iced tea or something like that. You really should just reach for water. Have more water in your diet. It can help a lot.
And you've sort of now cycled us into my next question, talking about prostate health and things like that. When should we begin, when should men begin screening for their prostate, and why is that screening so important?
So, there's always going to be, a dichotomy or difference of opinion when it comes to whether patients should be screened for prostate cancer or not. My opinion is, do we screen a lot of patients for prostate cancer, and maybe we're only saving 1 in 20, 1 in 30 lives? But that 1 in 20 life matters to me. And I think we have gotten significantly better when it comes to the screening and then the workup. So as of today, okay, so the way we follow it in our practice is that if you have a strong family history of prostate cancer, you should get screened once at the age of 40. That's if you have a strong family history. So in other words, you had a brother or a father that had prostate cancer. For all other patients, we start screening at 50. And we do it annually thereafter. Now, if you have an elevated PSA, or if you just have an abnormal blood test, my general rule is you never jump on one blood test, because there are flukes, and there's false positives and things like that. You'd be surprised how many patients, probably at least 20-30%, if you repeat the PSA, it comes back down, and the high test was just a fluke. And even if patients have a elevated PSA thereafter, we always choose MRI first. We don't always go to biopsies first, because biopsies, it's an invasive procedure. It does have possible complications. But just to review, if you have a strong family history, you should get screened at least once at 40, and then every few years after that. And then for all other comers, 50. But that's assuming you have at least a 10-year life expectancy. So if you've had if you didn't take care of yourself, for example, you're very obese and you've had 3 heart attacks and a stroke, but you're 50, that's not a patient I'm probably going to screen, because they don't have a 10-year life expectancy, because prostate cancer it's a relatively slow growing cancer.
I think the important thing there is, like you said, it might not be a lot of patients, but it's something that if you catch it in time, it is usually very treatable. And you don't want to have something going on medically that's gone untreated for a long amount of time.
Yeah, and you could always remember, these kind of conversations are two-way conversations. I'm never going to tell the patient, you have low risk cancer and therefore you must be treated. It has to be a decision that the doctor and the patient, they come together to form a treatment plan.
Excellent. Dr. Kim, is there anything you tell your patients in terms of if they have questions or if they're hesitant for any type of screening? I know with a lot of patients, screenings can be sometimes a little stressful, a little scary, because you're not sure what the outcome will be. So is there anything you tell anyone, sort of bring them in the office and get them started?
Yeah, I agree. I agree with what Dr. Patel said. It's every patient you have to have an individualized discussion with them based on their history and their profile. And I think my role is just to kind of give them all the information and make sure that they're making the most informed decision that's best for themselves and where they feel empowered to make that decision. I think for screenings in general, because aside from prostate cancer screenings, we're supposed to have our colon cancer screenings. Certain people are supposed to have lung cancer screenings. I always tell patients, kind of, if they're hesitant about it, I use the analogy of a seatbelt, right? You don't need the seatbelt 99% of the time you're driving until you do get into that one accident, right? So that's why I think it's important to screen for these conditions ahead of time, because if you do detect cancer early, you can, add years onto your life, and it could make a big difference down the road. So even if you're feeling completely fine, 100%, nothing's wrong with you, it's still a good idea to get the screenings at the age appropriate time because, you know, it can make a big difference.
Excellent. And that wraps up my questions for our discussion. Was there any final thoughts you wanted to share about men's health or, you know, anything in general specific to your specialties?
So kind of leading into heart health, you know, one of the things that we always tell our patients and, you know, in terms of screening for heart health, remember, you know, you don't want to wait to go see a cardiologist until you have a heart attack. That's a bad idea. But I actually do tell my patients, even like slightly younger patients, if they're starting to have erectile dysfunction, remember, erectile dysfunction is actually one of the earliest signs of poor heart health. Erectile function is based on really, really small vessels. So if you have disease of small vessels, for example, erectile dysfunction, I send all my patients who see me for erectile dysfunction, I generally tell them, listen, you need to go see a cardiologist and at least get screened and checked out. So for any patients that are starting to have, you know, a little bit of an issue with their erections, maybe they're not as firm as they used to be, that's probably a good time to see a urologist, but also simultaneously a cardiologist, you know, in that sense.
That's correct. I also want to congratulate Dr. Patel for waking up after only 1 cup of coffee. Takes 2 or 3 for me.
Well, I didn't want to say 2 or 3, but
no, but your opinion is right on.
And I'm just going to check the chat real quick, see if anyone has any questions. I have also included in the chat the contact information, the office location for our doctors this evening, if anyone would like to follow up with a visit. I don't see any questions tonight. I'll give it another minute in case anyone might want to pop anything in, but otherwise, thank you so much for joining us, doctors. Thank you for taking time to talk about men's health. Really great points tonight. I think the big takeaways that I got was balanced diet, regular exercise, and drink lots of water. And I think Dr. Patel is right. I think that last one gets lost. I am a tea drinker, not a coffee drinker, but I drink copious amounts of tea. So I'm not men's health related, but a good reminder for myself as well.
Thanks for having us.
all right. Thanks for having us.
Thank you. All right,
thank
looks
you.
like we don't have any questions, so I am going to let you guys go. Thank you again. Have a great night, everyone.
Have a good night, everyone.
Good night.
Take care.
Bye.